Good afternoon, everyone. Thank you for joining us for the Connecticut Affordable Housing Conference. My name is Carlene Chamos. I'm the Collective Impact and Equity Director at the Partnership for Strong Communities. We also have Chelsea Ross, a Deputy Director, who's assisting in this workshop as well. The Connecticut Affordable Housing Conference, or CAHC, features local, state, and national experts leading conversations that explore challenges, best practices, and brings us together around critical next steps to address key affordable housing issues. Our theme this year is Building Stability, where we are highlighting unique practices to strengthening housing stability for households and communities across Connecticut. We are live tweeting at hashtag CAHC 2022, and you can follow us at PSC Housing. This session is entitled Aligning Impact with Intention, Tools to Support Equitable Community Process and Optimal Housing Policy Outcomes. A few housekeeping items before we get started. The session is being recorded, and we'll make sure that all the recordings are available as soon as possible. All the participants have entered muted. Please remain on mute unless a speaker has asked you to unmute. If you have any technology issues, please feel free to reach out to myself or to Chelsea, and we will do our best to assist you. And your speakers will let you know how they would like content questions to be submitted. And post the session, we ask that you complete a session feedback survey by clicking on the megaphone icon in the lobby. Before I turn it over to our presenters, we would like to thank our leading sponsors: the Connecticut Department of Housing, the Connecticut Housing Finance Authority, Loza Building Group, the Melville Charitable Trust, and Wells Fargo. Their deep support has allowed the conference to happen again this year. Thank you to our collaborating sponsors. We have a handful of supporting sponsors that have helped make this conference happen. Thank you. And we want to say a big thank you to the Fairfield County Community Foundation for sponsoring this session. Lastly, we will be hosting our final I-Forum of the year entitled Tenant-Based Subsidies in Connecticut, Equitable Expansion. The I-Forum will take place Tuesday, December 6th from 10 a.m. till noon, and will feature an overview of tenant-based housing subsidy programs in Connecticut, who accesses these programs, the deep positive impact housing subsidies have on households' quality of life, and how we can work to ensure equitable expansion of housing subsidies. This is a vital conversation for all policymakers, service providers, developers, advocates, municipal officials, and tenants as we work to ensure everyone has access to safe, stable, and affordable housing. Now, it is now my honor to introduce this workshop presenters who will be engaging you all in an interactive dialogue around some of the personal, interpersonal, organizational, and systemic work that you might incorporate in your effort to address housing disparities in Connecticut. Mia Bryant is the Senior Program Manager at the Corporation for Supportive Housing. And we also have Kevin Collins, Health Equity Solutions Director of Training and Outreach. Unfortunately, Namanji could not join us due to a scheduling conflicts, but we know that she's sending us good thoughts and vibes as we walk through this workshop. And with that, I'm going to hand it over to Mia and Kevin. Thank you.
Awesome. Thank you so much, Carlene, and thank you to the Partnership for Strong Communities, and thank you all for joining us. Again, my name is Kevin Michael Collins, and I use he, him pronouns, and I serve as the Director of Training and Outreach. And I'll invite my colleague, my co-facilitator and co-presenter, Mia, to introduce herself.
Hi, I'm so happy to be here with you guys. Thank you for the opportunity. To the partnership, congratulations on this amazing conference. And as Carlene said, I'm Mia Bryant. I'm a senior program manager on the Federal Technical Assistance team at the Corporation for Supportive Housing, and I use she, her pronouns. So I'm happy to get into this conversation with you all today.
Awesome. And as Mia and as Carlene mentioned, this is going to be an interactive workshop, an interactive conversation. We'll present some content but then release you all into some breakout rooms for an activity that we hope will be useful and allow you to do some brain work. And as we enter into our conversation, I know we always start with group agreements, just so that we ground the space and make sure everyone has the same framework, right, as we enter into this conversation, right? So we always want to speak from I statements. We want to avoid making any generalizations. We want to listen for understanding rather than listening first to respond. I know it's hard, that's human nature, but we're going to listen for understanding first. We're going to take space and make space. What that generally means is that if you know that you're typically quiet during these types of conversations, maybe flex into your more making of or taking of space, right? So feel free to share and participate, obviously, as it is most comfortable for you. And if you know you're typically the one to raise your hand first and speak first, just acknowledge that there are other folks who internalize and process information differently, so may need some more time before volunteering to share. So just take some space, make some space as we enter into the conversation. Expect and accept the lack of closure. We have 90 minutes. There's a whole lot we want to get through. We may not get through everything. So accept that we may not be able to tie everything up with a nice little bow, but we will leave our contact information so you can reach out for any questions that you have. Be willing to be a bit uncomfortable. Some of these conversations today will center race, and we'll talk a little bit about redlining and its impact on policymaking. So things may get a little bit uncomfortable, but that's where learning happens. That's where change happens. So don't be afraid of that. We will try to make this as brave of a space as possible, so you won't be unsafe or in danger if you get a little bit uncomfortable. It'll be okay. So take the lessons, leave the people. We always like to throw that in there to make sure it's really just the Vegas rule in here. What happens in here, what happens in your small group, take what you learn, but leave any identifying information for folks. And then oops and ouch, acknowledging the impact that's maybe your words will have on folks, right? Maybe you didn't intend for something you said to have a negative impact, but if it does, we ask that you acknowledge it, apologize, and then we're gonna move forward with the conversation, right? Again, we're gonna encourage participation. This is gonna be interactive. So please, please, please participate at your comfort level, but maybe push past that level a little bit. What are some agreements that may be missing? Anything you all want to add? Feel free to enter it into the chat. Or did we nail it? All right, seeing none, I hope we all can agree to these group agreements. If you think of anything throughout, feel free to add in the chat and we'll make sure to add it to the group agreements. But we're gonna get started. We're gonna provide a few, oh, I see one, Renata Bertodi, come from a positive place. Absolutely, absolutely. We're all learning, we're co-creating and sharing knowledge in this space. So come from a positive place, a place of learning, a place of curiosity, absolutely. Any others? Yes, we love that, Renata. Thank you. All right, so we're going to get started. We're going to present a few concepts that will frame our conversation later on and how we're situating and talking about policymaking and decision-making, especially in a community context. So this may be a little bit lecture-y, but hang in there. We're going to get to the activity portion pretty soon. So we can go to the next slide. Awesome. So this is the definition, a definition of power that we typically use in our facilitations and our conversations at Health Equity Solutions. And it states that power is neither inherently negative or positive, but it can be developed and exercised as either power over or as power with, right? So kind of power over communities, over people, or shared power with others. It can be generated, redistributed, or shared. And power can be exercised in ways that affirm human dignity, protect individuals and groups from oppression, and support just and sustainable distribution of resources. Alternatively, power can be exercised in ways that undermine human dignity or oppress or disenfranchise individuals and groups, and maintains an unfair, unsustainable distribution of resources. Any questions on that? Okay. And as we talk about privilege, we define that as the unearned social power, right? That's accorded and given to specific groups by the formal and informal institutions of society, right? Given to a dominant group, for example, white privilege, male privilege, religious privilege exists here. Privilege is usually invisible to those who have it because we're taught to not see it, right? But nevertheless, it puts some folks at an advantage over those who do not have it. So that's our working definition of privilege. And I'll pass it to Mia.
Thanks so much for that, Kevin. As you all are thinking about those definitions that Kevin shared, it's important to really consider what the culture look is in America and within our society as we think about how power is used and given and shared and et cetera in our country. It's important to consider, what the dominant norms are. And so dominant norms they often shape our institutions, our culture, the way we see ourselves, the way we see other people. And in our country, white dominant culture has become a norm within our society. And that's largely due to white supremacy and the deliberate suppression of other cultures throughout American history. So as we consider that, it's important to consider what are those white dominant norms. This excerpt is taken from White Dominant Culture and Something Different. And one of the white dominant norms that I highlighted here on our screen is power hoarding. So power hoarding is when ideas from less senior people are treated as a threat, information and decision-making is confidential, and holding on to resources and having a scarcity mindset. Power hoarding is often a white dominant norm. And so as we think about ways that we want to shift to something different, something that may be inclusive, one idea can be to consider power sharing. So ideas that all levels are valued for the positional expertise they represent, and ideas from others are requested and space is made for them to be able to be heard. Budgets are made available for viewing, providing input on, resources are shared equitably and appropriate. So it has this leveling effect, this leveling impact, as opposed to it being power being held by just a few people where decisions are made in silos. On the next slide, as we're thinking about, ways to share power, how can we be liberated gatekeepers? So we all possess some type of power and privilege. We all have some form or some level of power and some level of privilege. And so to be a gatekeeper is when we're keeping that power inaccessible to others. So decisions are being made in a vacuum, being made in silos. When we're liberated gatekeepers, we're using our power and privilege and influence to open and break down those gates and to liberate others. And that's where you get into some of that power sharing. So think about how you can use what your power is, but also use your power to shift that dynamic within your community, within your sphere of influence. Next slide, please. So these are just the different types of power that exist. You can have power, and Kevin also highlighted some of these earlier. You can have power in something or power to do something, power over a decision or power over a certain type of entity. But then you can also have power with or shared power that isn't just solely yours, but that you're sharing with others. Another that I want to highlight is the power to empower others and be able to sow those seeds into other folks within your community. Next slide. So as we're thinking about power and what to do with it and what power we have, it's important to really think about ways to analyze our power, to better understand how to be liberated gatekeepers and to be able to share our power. So one way to do that is by power mapping, one step you can take. And power mapping is where you analyze the power and where it lies and understanding where some of those gaps exist. Oftentimes, a lot of inequities fall between race and ethnicity. And you see that people who are Black, Indigenous, or other people of color who are, for example, folks who are Latinx, oftentimes experience a number of inequities where power has been taken from them and where they're kept out of certain decision-making, especially decisions that affect them most, have the most impact on their communities. So we want to examine also the ways that institutions have acted oppressively as opposed to working collaboratively to eliminate disparities. And in what ways has power been intentionally taken away from certain communities and other folks have been oppressed as a product? And then shifting from this needs analysis to a power analysis, how can we share power? How can we invest? And how can we increase the power that a community has within our community? What are some ways that we can do that? And really taking that, shifting that mindset from what a community needs to how can we uplift and support them to have power over and within the decisions that happen within their community. With that, that's the action. So actively work to restore power within these communities that have been historically and systematically disempowered. That's the work that we want to get into today, that conversation we wanted to get into today. Next slide. The conversation is about sharing power in community. So thinking about how decisions are currently made, what currently exists, when we're thinking about our policy priorities, when we're thinking about our budget priorities, when we're thinking about, current stakeholders and who makes these certain decisions, what currently exists and who's involved in these conversations. And then who needs to be part of these conversations? Do these relationships currently exist? Has there been trust broken? In order to build these relationships, we need to rebuild this trust. And then the decisions that are on the table, what are some of the most pertinent things that you all are thinking about now? Who do these decisions impact most? And so really being considerate and thoughtful about engaging with folks that these decisions impact most and being able to involve them in this process to be able to share power. Because you want to ensure that these decisions are reflective of the community interests and what is going to have the greatest impact on the communities that you all are serving. So now I'm going to pass it back over to Kevin to talk about autonomy.
Absolutely. Thank you so much for walking us through that, Mia, especially leading or leaving us with action, right? And really transitioning us to this active piece of the workshop, right? Because this is what we want you all to do, right? You have to be action oriented in your power sharing and your decision making. So when we were crafting and coming up with the content for this session, a lot of what we were talking about reminded me of advocacy work and the work that we do and how we conceptualize advocacy here at Health Equity Solutions, right? So when we think about, and as we continue to contextualize power sharing, especially in decision-making, policy-making, and community engagement, it's important to know some of these overarching concepts that relate to advocacy and how they can be applied to your decision-making and policy-making. So generally, advocacy is defined as the act or process of supporting a cause or proposal or policy or decision that you're thinking about making, right? And it's the process of advocating for something. It's the advocacy is making your voice heard, right? Individually or collectively. In this instance, we would hope that it's more collectively, leaning on the power of community and uplifting other voices and sharing the mic. right, on issues or policies or decisions that are important to you. And we can go to the next slide. So in our decision-making, in our policy-making, it's important to understand the what, the who, the how, the where, the when, and the why, especially in your equitable decision-making, right? What issues or policies are you advocating or creating? Who will be most impacted by that policy? How do you know what that impact will be? What medium will you use to collect data and information on how that, or on what that impact will be? What is your why? And why is this policy important to you and those you work in community and in collaboration with? The REIS tool that we're going to introduce in the next slide is an excellent method, right, in utilizing tenets of advocacy, power sharing, all of that, and analyzing a potential policy for its impact and its equity, right? It's a great way to measure how equitable a decision or a policy that you're thinking about making, or your budget is, right? And analyzing that impact on folks, especially folks of color. You can go to the next slide. So this slide gives us an important overview and background of what a racial equity tool is. Sometimes they're called racial and ethnic impact statements. That's why you see REIS. And sometimes they're just called racial equity tools, right? A racial equity tool is designed to integrate explicit consideration of racial equity in decisions, in policies, practices, programs, budgets, you name it, right? It proactively seeks to eliminate racial inequities and advance equity. It identifies clear goals, clear objectives, as well as measurable outcomes. And as you can see on the right, this is an example of a process of ways to utilize this tool. And it's the use of a racial equity tool that can help develop strategies and inform actions that reduce racial inequities and improve success for all groups. So we like to think of racial equity tools as the overarching umbrella, and as I mentioned, there are different names and different types of these tools, but the end goal is all the same. It's to create a mechanism that is sustainable, accountable, and successfully addresses the impacts of policies, budgets, and programs on racial equity. And to walk us through the way to use, how one could use a racial and ethnic impact statement or a REIS tool, we have Karen on our policy team here at Health Equity Solutions, who will walk us through an example.
Hello, and thank you for being here today. I'm Karen Siegel, and I'm the Director of Policy here at Health Equity Solutions. I'm going to talk through how racial and ethnic impact statements are used and give you an example of how to apply these tools to Connecticut state policy. As you just heard, Connecticut legislators can request a racial and ethnic impact statement on any piece of proposed legislation. So that brings us to the question, what are racial and ethnic impact statements, or REIS as some folks call them? Well, there's many versions of these tools, and sometimes they go by other names, one of which is equity impact assessments. These tools are used to hold ourselves accountable for considering whether a policy is likely to advance equity or exacerbate inequities. Versions of these tools are used at all levels of government. That means municipalities, state agencies, by legislators, and by state-run programs. They're also used by corporations and direct service providers to assess the equity impact of the decisions that they make and changes to policies and programs that they make. Systemic racism is so deeply embedded in our ways of doing everything, including governing, and these tools help us to identify and dismantle the racism that is woven into our norms and our longstanding policies. Here at Health Equity Solutions, we use a health equity impact assessment tool to assess any policy that we support or oppose in order to hold ourselves accountable for making sure our positions are grounded in evidence and that the most equity-focused version of a policy is what we are supporting. We also help to build these tools for other organizations. So racial and ethnic impact statements often consider the following areas. So first, what is being proposed? Next, a hypothesis regarding whether or not what is being proposed is likely to have an impact on racial and ethnic equity. Then looking at the evidence of disproportionate impact based on who the policy will impact and the effectiveness and unintended consequences of similar policies in other places. And finally, an evaluation. So based on the evidence, would the policy be likely to have a disproportionate impact? So to give a clear sense of how this works, I'm going to walk you through how we might conduct a racial and ethnic impact statement on a specific policy. So for an example, we've chosen a policy that was considered this year by the Connecticut General Assembly. So the governor's proposed budget adjustments for 2022-2023 included an increase to adult dental and endodontic rates in Medicaid. And the statement explaining this proposal said the following: currently, adult dental services are reimbursed at 53% of the fee schedule for children. This proposal increases adult dental rates by 25%. In addition, to address significant access issues, rates for adult endodontic rates are further increased to align with the child rate. In total, after factoring in the federal share, the proposal will increase Medicaid expenditures for adult dental services by $9.2 million. So based on that policy proposal, our hypothesis was that increasing dental provider rates would in fact increase the availability of appointments for adults enrolled in Medicaid, partly addressing existing inequities in access to dental care. So then moving into the evidence phase of the assessment, we look at a number of questions about who would be impacted and how we know what the impact might be. So taking these one at a time, will the proposal have impacts in a specific geographic area, neighborhood, area, region, county? What are the racial demographics of those living in the area that will be impacted? Well, Medicaid's a statewide program, and the impact of this change will be statewide. But we know from the Medicaid dental programs analysis that dental care is used far less by enrollees living in 25 specific towns. So of enrollees who did not utilize dental services through Medicaid, they were largely concentrated in these 25 municipalities. And those towns, again, which are listed in the report, we know from census data are disproportionately lower income and have higher concentrations of Black and Latino residents than other parts of Connecticut. So next we would ask, does the proposal impact services or conditions that disproportionately impact certain demographics? So considering age, income, health conditions, life experiences, and access to basic needs. And part of the reason for enumerating all of this is that we know that among the consequences of systemic racism is a disproportionate likelihood that Black, Latino, Latina, Indigenous, Asian, and other people of color in our state are more likely to be impacted by negative social determinants of health, by social and economic factors that limit their access to opportunities to be healthy. And so thinking about this policy specifically, we know that this policy only impacts adults and only impacts lower income adults because they have to be enrolled in Medicaid, which only accepts lower income residents of the state. We also know from the Medicaid dental programs reporting that adults enrolled in CAHC, which is the state's Medicaid program, underutilize dental services. So compared to children, adults are far less likely to use dental services. And finally, we know that access to dental care is a universal need and one for which there are existing very wide disparities on racial and ethnic, when assessing racial and ethnic utilization of them. So next we would ask, does the bill address the work of one department or agency, and what are the demographics of the population served? So in this case, again, yes, the bill is impacting one Department of Social Services program, and that program is Medicaid, and the bill only impacts adults who are enrolled in Medicaid. And we know from Medicaid data and from the census data that Medicaid enrollees in Connecticut are disproportionately Black and brown. So next, we would say, what does the data at the population level tell us about existing racial inequities in this issue area? Well, we know from, again, the Medicaid dental programs reporting that 2 out of 3 adults enrolled in Husky are not accessing any dental care. We know that from the academic literature that the rates of oral cancer and tooth decay are much higher, particularly for Black and Latina communities. And we also know that the availability of appointments for Medicaid dental patients has decreased, and that there's only one provider in the entire state who was currently accepting endodontic appointments at the time that this proposal was made. And so then next we would ask what performance level data is available for the proposal. So basically, what evidence is there that this proposal would have an impact on equity and of its efficacy as a proposal more broadly? So we know, again, from the Medicaid dental utilization data that adults are less likely than children to use dental care. We know from both the Medicaid dental data and the Connecticut Oral Health Initiative's research, or the preliminary results of their research, that dental appointments are quite difficult to access. This is a common concern of Medicaid enrollees, and also it's the result of the secret shopper effort. And finally, we see in the academic literature that the impact of rate increases can have an impact on access. So if a rate increase is large enough, it is possible that it will increase the number of available appointments. And in this case, it's a relatively large increase that's being proposed, a 25% increase. And then lastly, we would ask, regarding the evidence, are there any data gaps? What additional data would be helpful in analyzing the potential impacts of this policy? So in this case, we were not able to find specific data on the impact of rate increases on racial equity. We were not able to find specific data on dental rate increases impact on access to dental services. And we know that the state's Medicaid data is demographic data is quite incomplete and or not very high quality. And so we looked at both the census and the Medicaid demographic data to look at the impact on populations served and the racial and ethnic makeup of that population. So then that moves us into the evaluation phase. So taking all of what we found in the literature released from the state agency and in the academic literature, we need to make an assessment. Will this proposed law have a disproportionate impact on any racial or ethnic subgroup, whether intentional or unintentional? And in this case, we would break it down a little bit further. Would it have a disproportionate impact? Yes or no? Or was that impact unknown, and why? Is it due to unavailable data or another reason? Or was the organization doing these statements unable to have sufficient time to evaluate the available data or to identify the available data if it was difficult to locate? So in this case, we would say that the bill would have a disproportionate impact on racial or ethnic equity, and we need to explain how we got to that conclusion. So how did we make that decision? We looked at academic literature, we looked at state data analysis, we looked at the demographics of the impacted population. And so we determined that yes, it would have a disparate impact because there are racial inequities in access to oral health care and in access to health insurance that makes Medicaid disproportionately representative of Black and Latina residents of our state. There is a barrier to care that is addressed by the proposal, which is that there's an inadequate availability of dental appointments. And finally, we saw in the academic literature that large rate increases do have the ability to improve the availability of appointments. And in this case, there had not been an increase in adult dental rates in over 14 years, suggesting that this is an increase that is overdue and would have an impact. So, and then finally, we might ask ourselves after the evaluation or at the end of the evaluation, what changes might increase the bill's chances of advancing equity or mitigate its chances of increasing inequity? And in this case, the one thing that arose from reviewing the literature was that the endodontic rate was being aligned with the child dental rate, but for adults, The adult dental rate more broadly, not related to endodontics, was being increased by 25%. And there was a suggestion based on the literature reviewing rate increases in primary care that aligning the dental reimbursement rates for adults completely with those of children would potentially have a larger impact on the number of dentists enrolling as Medicaid providers and or on the number of Medicaid appointments that dentists are willing to make. So that would be one potential thing to consider in finalizing that policy. So thank you very much for your time, and I hope this was useful, and I hope you enjoy the rest of the workshop.
Awesome, awesome. Thank you to Chelsea for the Zoom magic and making that video happen. And of course, thank you to Karen for giving us that walkthrough. Everybody take a deep breath. I know that video was heavy. It was very, very intricate, detail-oriented, as it should be, right? But I hope that what you were able to glean from that really is that a REIS tool or a racial equity tool really is a set of questions, right? To analyze the impact, the racial and ethnic impact that a policy, a budget, any sort of decision has on Black, Brown, and other people of color, right? So and while that example was heavily legislative focused, right? We do hope that you know that you can utilize this framework, this tool as a company, as an organization, really surrounding any sort of decision that needs to be made, budgetary, right, programmatic, any of those decisions, you can utilize a REIS tool to analyze the impact. So what we're going to do, we promised that this would be interactive. So what we're going to do is send you all into breakout groups where we ask you to do something similar to what Karen did, right? We're going to give you an example of a policy that we may or may not be familiar with, right? We're going to use redlining as an example policy that we're still feeling the effects of today, but it was a policy heavily utilized in the early and mid-century development of our country, right? Redlining is the illegal discriminatory practice in which a lender denies loans or an insurance provider restricts services to certain areas of a community, often because of the racial characteristics of that applicant's neighborhood, right? So that's what redlining is. What we want you to consider when we send you into breakout groups, we can go to the next slide. What we want you to consider is who was most and who is still most impacted by redlining as a policy. Who has benefited because of redlining? Did redlining as a policy minimize harm for those who were already deeply impacted by discrimination, or did redlining exacerbate those discriminations, right? And then how do we know? And then what opportunities, what policy opportunities or possibilities exist to increase opportunity and access to resources that redlining stripped away from communities? So we're going to give you about 15 minutes in breakout rooms. We'll float throughout breakout rooms to see how everyone is doing. And then we'll pull you all back. We're nosy and we would like to hear what you all came up with, what you all talked about. And we'll leave time for some questions and share out. But we're going to send you into breakout rooms. Now there should be about 5 or 6 folks in each room, and we'll pop in to make sure things are going smoothly. We all set with the breakout rooms?
Yes, we are. I'm gonna send everyone to their breakout rooms right now.
Awesome.
See that we still have a few people who are still with us in the main room. I want to send them to their room.
Carlene, I moved a couple folks who were in rooms by themselves.
Thank you. Slowly happening.
Oh, for the recording. Would anyone like to share anything that they learned or talked about within their group? Any highlights or impactful, conversation you guys had? And you guys can feel free to just unmute or raise your hand and we can call on you, however you like to participate. And the chat is always an option too. One thing, while we're waiting for some brave volunteers, one thing I want to highlight is something that Aisha and Ali were talking about. You guys want to share that event that you guys said is coming up? I think it was Undesigned, the Red Line. Are you guys able to unmute? Maybe I just assumed you were able to.
Yep. Yep. I can unmute and talk about it a little bit. And I know that we'll be putting a link in the chat, but it's called Designing for Democracy, or the Practice of Democracy. We hold these truths, which will be an exhibit going through Gateway Community College, Norwalk Community College, and Housatonic Community College, which is a visual space where you can kind of walk through the historical context of redlining in Connecticut and how that's impacted the housing space today. And yeah, really looking forward to that. I forget the dates in particular, but I know the link will have all of that information.
Thank you, Ali. I'm just looking for the link that's specific to the exhibit, and so I will post that as soon as I find it.
So this group talked about, they brought that resource up in regards to what opportunities exist to increase opportunity and access to resources. So education is one huge thing. This exhibit that they're talking about is going to be exhibits that happen at community colleges or various community colleges throughout Connecticut, and we'll give some information about redlining. So, in one group, we were talking about, well, redlining kind of predates us. This happened before any of us were able to have an impact on it. And another person said, but it still exists in terms of the practice in some cases, but then also the impact that it's having. So what are some things that we can do? And education was one thing that another group had mentioned as an opportunity. So as we're thinking about the race equity impact and what we can do, education is definitely one thing. How can we engage others within this conversation of the issues that surround a policy? Anything else anyone wants to highlight about what they discussed? Or ways to increase opportunity?
We saw the mics moving, so we know there was conversations happening. Thank you, Jean.
I'll share something that we spoke about. Being that I used to live in Hartford, so I know what's been going on there as far as redlining, but also the mindset. There's a mindset of people. They get comfortable. People get comfortable in their own drama, so they get comfortable where they're at, and they don't know how to get out of that, out of that situation. Yes, we can educate them, but we need to shift their minds into thinking that they can do more. They can go out there and fight for more, do more for the community, but they get so comfortable. And I say this because I've seen it out there. I have family that live out there. They get comfortable. Oh, we're fine. We pay this. We're okay. But that mind shift, it has to change.
Absolutely, absolutely. A mind shift as well as policy shifts, right? To make sure that there are resources out there. There are the necessary tools in place for after the mind shift, the actual shift to happen, right? For folks who want to move on out, that there are homes and affordable places to live out there. So absolutely.
And I would say too, on the topic of redlining, it has had a generational impact. So a lot of people, this is what they know. The lack of affordable housing, poverty, these are things that they have potentially experienced for generations. And so sometimes people don't know what options are out there. Sometimes people don't know that what's happening to them is wrong and illegal, and and that they have more options. So I think that resource piece is very important. And Marisol, that kind of conditioning that folks may have is important to consider when we think about partnering with folks who our decisions are most impacted. How can we establish those relationships? How can we inform them, empower them, and just educate them on how they can advocate for themselves and encourage them to be able to contribute in this way? Because you're right, Marisol, but there is like a conditioning and a mentality sometimes that folks get in because of the trauma and the harm that has already been done. So I think that's really important to highlight. All right. So I think we'll move on, and feel free to keep sharing, anything that comes to mind in the chat. If there's anything else that you all want to share about what you discussed. So in terms of, some of the wrap up, one thing we wanted to kind of highlight for you all is that there's so many efforts that are currently going on within your cities, within your regions, but also within the state and federally that are happening that is aimed at addressing housing instability. You have a lot of work around rental assistance. I know many of you have in Connecticut received EHVs, emergency housing vouchers, but there's also some other things that are going on. There's a lot of work around tenants' rights and zoning reform. And so considering who we have on the call, I know just in the groups I was in, we have city planners, we have community development folks, housing equity folks, there were some lenders, bank representatives on the call, and just so many more. Just consider, what work you're doing now, decisions you have influence over or within, what type of power you have. We talked about the various types of power. And then what are some opportunities that you have or you can create to engage in this race equity impact statement process that we discussed today? What are some ways that you could be intentional about making an equitable impact within these issues and these efforts and others that you might be engaged in related to housing affordability? And I think we'll open it up to questions. Any questions you have, anything that's coming up for you as you think about the work anything we talked about today, any work you're working on, you're like, how can I apply this to my work? Like, does this make sense? We'd love to engage in that conversation.
Thank you, Renata.
Any questions?
Questions, thoughts, considerations?
All right.
Well, thank you so much, Kevin and Tajmia. And if you have any questions, you can still send those to us post-session. You can fill out the post-session feedback, and I'll be happy to share those with Kevin and Mia after the workshop. I truly appreciated the time that we spent together. Appreciated you walking us through the REIS tool, Kevin, and actually bringing this tool to all of us who were able to attend this session today, because I know that is something that, Chelsea and I, we've started incorporating some of those questions, some of those suggestions into some of the work that we are doing. And I know that it is something that could be modified and incorporated in all of our processes as we work to develop policies, programs, and legislative priorities. And because when you start looking at the wealth gap, access to housing resources, the achievement gap, health disparities, people of color are disproportionately impacted. So over the last 2 days, I know a lot of people who are joining us today, they've been hearing a wide range of conversation around what's happening around Connecticut. And like you mentioned before, Mia, access to rental assistance, the need for zoning reform, and the need for more affordable homes in the state of Connecticut. So I hope that you guys can take this tool with you to your everyday work. And thank you all for joining us. And don't forget to fill out the survey again. I don't think I'm going to stop it because we want to hear your thoughts and your feedback. And with that, bye everyone.